Diabetes. Diabetes is a chronic condition in which the body is unable to regulate blood glucose levels properly. Glucose is a type of sugar that is the primary source of energy for the body's cells, and insulin is the hormone that regulates the amount of glucose in the blood. In type 1 diabetes, the body's immune system attacks and destroys the cells in the pancreas that produce insulin, leading to a lack of insulin in the body. This type of diabetes typically develops in childhood or adolescence, and people with type 1 diabetes require lifelong insulin therapy to regulate their blood glucose levels. In type 2 diabetes, the body becomes resistant to the effects of insulin, and the pancreas may not produce enough insulin to compensate. Type 2 diabetes is more common in adults and is often associated with obesity, physical inactivity, and a poor diet. Other types of diabetes include gestational diabetes, which develops during pregnancy and usually resolves after delivery, and various forms of secondary diabetes, which are caused by other medical conditions or medications. Diabetes can lead to a range of complications over time, including heart disease, kidney damage, nerve damage, and vision problems. It is important for people with diabetes to manage their blood glucose levels effectively and to receive regular medical care to prevent or manage complications. Causes of diabetes. There are several factors that can contribute to the development of diabetes. The most common causes of diabetes are: 1. Genetics. Family history and genetics can play a role in the development of diabetes. If a person has a parent or sibling with diabetes, they may be at an increased risk of developing the condition. 2. Lifestyle factors. Poor diet, lack of physical activity, and being overweight or obese can increase the risk of developing type 2 diabetes. Eating a diet high in sugar, refined carbohydrates, and saturated fats can cause insulin resistance and increase the risk of developing diabetes. 3. Age. As people age, their risk of developing type 2 diabetes increases. This may be due to changes in hormone levels and decreased insulin sensitivity. 4. Ethnicity. Some ethnic groups, such as African Americans, Hispanics, and Native Americans, have a higher risk of developing diabetes than other populations. 5. Medical conditions. Certain medical conditions, such as polycystic ovary syndrome, PCOS, and pancreatitis, can increase the risk of developing diabetes. 6. Medications. Some medications, such as corticosteroids and certain antipsychotic drugs, can increase the risk of developing diabetes. It is important to note that while these factors may increase the risk of developing diabetes, not everyone who has these risk factors will develop the condition. It is important to maintain a healthy lifestyle and to receive regular medical care to help prevent or manage diabetes. Prevention from diabetes. There are several steps that people can take to reduce their risk of developing diabetes. 1. Maintain a healthy weight. Being overweight or obese is a major risk factor for developing type 2 diabetes. By maintaining a healthy weight through a balanced diet and regular exercise, you can reduce your risk of developing diabetes. 2. Eat a healthy diet. Eating a diet that is rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help to reduce your risk of developing diabetes. Avoid processed foods, sugary drinks, and foods high in saturated and trans fats. 3. Exercise regularly. Regular exercise can help to improve insulin sensitivity and reduce the risk of developing type 2 diabetes. Aim for at least 150 minutes of moderate intensity exercise per week. 4. Quit smoking. Smoking increases the risk of developing diabetes, as well as other serious health conditions such as heart disease and lung cancer. 5. Manage stress. Chronic stress can contribute to the development of diabetes. Finding ways to manage stress, such as through meditation, yoga, or deep breathing exercises, can help to reduce your risk. 6. Get regular checkups. Regular medical checkups can help to identify and manage any risk factors for diabetes. It is important to have regular blood sugar checks, especially if you have a family history of diabetes or other risk factors. It is important to note that while these steps can help to reduce your risk of developing diabetes, they are not a guarantee. Some people may still develop diabetes despite their best efforts to prevent it. It is important to receive regular medical care and to follow any recommendations from your healthcare provider to help prevent or manage diabetes. Bye bye. Take care.